Hello, everyone. My name is Dr. Macharia Waruingi. I welcome you to Decentralized Health at Ubrica project. Today, I want to introduce you to a new broadcast program from Ubrica. In this program, I bring you critical technical knowledge about creating perfect conditions for much needed revolution in health industry. Under these new conditions, universal health access will be possible. Everyone in the world, including you and your loved ones, will have access to the best health services available in the world. Health for everyone will be of the highest quality there is in the world and to be affordable to all. I'll be coming to you each and every day from Ubrica project located at 1.4 degrees south of equator and 37 degrees east of the central meridian. Today, I have an interesting topic to discuss with you, which is the blockchain in healthcare marketplace. Drivers, restraints, opportunities, threats, trends, applications, and growth forecast by 2028. This is an excerpt from a report developed by marketresearch.biz. But first, the basics. Ubrica project strives to solve three fundamental problems of health production in the world. Number one, lack of access to health services. Number two, poor quality of medical services. And number three, high cost of medical services in the world. SokoJanja.com is the online retail store where anyone in the world can sell what he or she produces to increase the earning power. Money in pocket means realized access to health. Ubrica clinics and hospitals project ensure physical access to health services. Ubrica's life science and technology parks create places for translation and commercialization of new and relevant knowledge, ensuring best quality of medical services in the world. And then Ubrica Biomedical Industrial City promotes local manufacturing of biomedical products, reducing cost of medicine and medical devices and health services in general, making health affordable. Now finally, the Ubrica coin, the icing on the cake, the cryptocurrency for universal health access underwrites health production in Ubrica ecosystem. You can support universal health access by getting and adding Ubricoin to your portfolio of cryptos by getting equity in Ubrica project. So get involved today. Do not sit on the sidelines of health. Now, as you watch this, I would like to invite you to smash the like button, smash the bell button as well so that you can receive notification and participate in the chat. Write your reviews on how we can decentralize knowledge in health and medicine. Now, for those in the chat, please tell us where you're from so we can get to know each other. Today's topic, as we said, is global blockchain in health market analysis, trends, applications, analysis, growth, and forecast of 2028. This report was generated by Market Research Base, and of course, all we have to do is give you some highlights so you can know what's happening in the global blockchain space in health. One, blockchain technology is widely used to offer efficient healthcare services all over the world. Today, pharmaceutical industries are facing major challenges associated with drug counterfeiting, where ingredients and dosages, including medicines, vary due to which products trigger whatever unexpected secondary effects. That's very important. So blockchain is used in pharmaceutical industries, particularly to prevent counterfeiting. And deploying blockchain technology into pharmaceutical system aids to eliminate major drawback for counterfeit drugs. I can tell you that here in Africa, counterfeit drugs are about anywhere from 50 to 60%. 50 to 60% of drugs that are in circulation in many African countries, particularly here in Kenya, are counterfeit. That's one. And of course, we're going to overcome that problem with blockchain. Number two, market dynamics. Blockchain technologies will help us to overcome two major issues associated with drug traceability. First, blockchain structure will allow end user to track products down the supply chain by creating airtight circuit and offers impermeable counterfeit products. All right, that's great. That is we're talking about supply chain management. Secondly, a blockchain will allow stakeholders, especially production facilities to take responsive actions by identifying exact location of the drugs, and that is really good. Now let's talk about what opportunities there are in blockchain according to marketresearch.biz. There's going to be increasing government initiative and rapid growth in funding. That is important. Rapid growth in funding, particularly through coin offerings and venture capital investments. Now we can see that our Ubricoin, as it is growing in the marketplace, it offers many funding opportunities for promoting health production in Africa. As we said, that the work of Ubricoin itself, which is the glue that puts together the entire Ubrica project, is to increase access, to improve quality, and to reduce costs. And we have explained how that works. Now, blockchain in healthcare market regional insights. We have seen, of course, North America is expected to dominate as usual. But what happens in Africa? Africa, we have to bring the attention to the world about the blockchain itself. We're saying that there is unprecedented expected revenue growth in the target markets, particularly in Latin America and also in Africa. So we expect much growth in health industry in Africa, and this is where blockchain is going to come and help us a lot. Now, if you think that blockchain may not work in Africa, is because you do not know that almost 1 billion people living in Africa do not have access to good quality medical care. Again, the Ubrica project, as we said, it's about solving 3 fundamental problems of health production: lack of access to health services, poor quality of medical services, and high cost of medical services in the world, particularly in Africa. Now, these 3 problems, we want to solve them by, first of all, creating access to money through Soko Janja, an online retail store, which is like Amazon.com. But right now, this Amazon.com that's going to Soko Janja is this retail store that is going to reach every village in Africa, and so that everyone can sell what he or she has produced. And this will increase the earning power. Money in the pocket means realized access. It means that if someone has money, no matter where this person is, even in a remote village, they'll be able to pay for their own transportation to the nearest medical facility. What if we build those medical facilities and get them distributed as much as possible in the country? So we can build clinics, and this the Ubrica clinics and hospitals project, and this will ensure physical access to health services. And then to increase the quality of knowledge, we go into partnership with universities, and where we create science and technology parks. And these science and technology parks will create places where we can translate knowledge and commercialize knowledge to create new and relevant technologies that will ensure the best quality of medical services. That is good. And then, of course, to reduce cost, we have to have local manufacturing, where Ubrica Biomedical Industrial City will promote local manufacturing of biomedical products, reducing costs of medicines and medical devices, and then, of course, reducing the cost of health services in general. And this will make healthcare affordable. Finally, we are going to make use of the Ubricoin, which is a cryptocurrency for universal health access, to underwrite all that health production ecosystem. Now we encourage you to strongly support universal health access. One, by going to the exchanges and buying Ubricoin, or buying Ubricoin directly from the contract address, Ubricoin contract address. You can find that on Ethereum network, that is etherscan.io, and then you add that to your portfolio of cryptos, and then also you can get equity that you get stake in the Ubrica project itself. That's paramount. Get involved. Do not sit in the sidelines of health. Thank you so much. Thank you. And we're going to come to you every day talking about these topics as we go along. Thank you.